Good morning. This hearing will come to order. We're here today to discuss an issue that is important to every one of us. We're here today to discuss cures. Cures to life-threatening diseases. Cures to diseases that devastate the lives of millions. We're here today to discuss what we're doing well and what we could be doing better to open new frontiers. The United States has led the world in path-breaking medical research, and yet there's far more we could be doing. In the year 2015, it's estimated almost 600,000 Americans face cancer. Another 700,000 with Alzheimer's disease are expected to die this year. Nearly 500,000 people in the United States suffer from the effect of Parkinson's disease. 795,000 suffer strokes each year. 25.8 million people are afflicted with diabetes. And 95% of other rare diseases currently have no recognized treatments or cures, leaving most of the 30 million patients afflicted by them with few or no options. The path to achieving medical breakthroughs in cures is long and capital intensive. Yet often it seems when it comes to medical research that we're penny wise and pound foolish, that we pay billions or trillions on the back end dealing with the consequences of horrific diseases, rather than investing and creating the incentives on the front end to cure these diseases once and for all. The average cost to get a single drug approved by the FDA can cost between $1 and $2 billion. In addition, the regulatory burdens and bureaucratic unpredictability slows the ability of innovators to create new cures. Regulatory burdens and uncertainty is also having an effect on private investment. In 2011, the National Venture Capital Association issued a report confirming that U.S. venture capitalists are reducing their investments in biotechnology and medical device companies, and are shifting their focus overseas to Europe and Asia, primarily due to the persistent regulatory obstacles at the FDA. Despite these daunting and persistent challenges, I continue to believe that incredible American ingenuity still has the power to fuel a revolution and to open medical breakthroughs. As former FDA Commissioner Andrew von Eschenbach has stated, we stand on the cusp of a revolution in healthcare. Advances in molecular medicine will allow us to develop powerful new treatments that can cure or even prevent diseases like Alzheimer's and cancer. As we begin a discussion this morning on how we can unlock cures for America's most deadly diseases, we'll take a global look in examining how the American regulatory system compares with the rest of the world and how incentives can change so that in the coming years we have more and more breakthroughs rather than less and less bureaucratic inertia. Whether it's increased federal funding through direct medical research, whether it's using tools such as prize competitions, whether it's intellectual property reform or easing the burdens for approving new drugs and medical devices. All of those are steps that are going to need to be examined closely if we're going to take major steps towards new cures. American poet Robert Frost once stated that freedom lies in being bold. That's the approach all of us hope that we take. And it is in that spirit that I welcome our panel of distinguished experts and friends to engage in a discussion of creating bold solutions that will enable medical discoveries to cure and to prevent deadly diseases. Senator Peters.